Hi everyone, my name's Liz. I'm Liz Neal and I am a certified Gottman couples therapist and trainer. I'm so excited to be with you this morning. We're going to talk about all things Gottman and I'm really happy to give you insight into my experience of why Gottman couples therapy is such a great model to work with. So I'm going to be answering some questions this morning, and the first question for me is to tell you a little bit about myself as a couples therapist. So I am traditionally a psychologist, and I started my Gottman journey in 2014. And in 2017, I became a certified Gottman couples therapist. And in the last couple of years, I have become an official trainer for the Gottman Institute. I've really gravitated towards utilizing Gottman couples therapy in my work because it just seems to make so much sense, right? It's come from research. It's very intuitive, and yet it is so easy to apply because it just makes absolute sense. Couples come in understanding that what they're trying to achieve has been based on what we know happy couples are doing. And so it's really easy to explain and understand for couples who are really wanting to address issues in their relationship as well. Cole, I'm ready for the next question. So as a Gottman therapist, I'm going to tell you the real value this approach has with working with couples. So this model has been created from observing systematically what couples are doing, right? So there has been systematic observation to understand what happy couples are doing and what unhappy couples are doing. So from decades of research, we've been able to measure what is dysfunctional in relationships, right? So we can describe what is dysfunctional in relationships, but also we've been able to observe and understand what is functional in stable and happy relationships. So the value for this means that we can help couples identify the negative patterns of interaction that they have. So we're able to say, what you're saying right now to your partner sounds like criticism. And what we know from the research is that couples who express what they feel and need through criticisms are going to sabotage their chance of being heard. So we're able to describe these are the things that we know from research mean that couples will struggle in their relationship. And on the flip side, we're also able to find out what is it that happy couples are doing, right? So John Gottman's research was able to find out that we can actually identify what a happy relationship looks like. And there are factors that we're able to measure our couples with against what these factors are, okay? So we can constantly assess how is a couple doing in their friendship and intimacy part of the relationship. How is a couple doing in terms of their conflict management? How is a couple doing in terms of repairing misunderstandings? How is a couple doing in terms of what they're investing in to make their life a full life with a sense of meaning and purpose? We're also able to identify comorbidities that either one or both partners might have that becomes problematic within the relationship itself. So the value that Gottman Method Couples Therapy has provided for my work and your work is that we have this really systematic approach in terms of assessing for couples. We know what we're assessing for. We can identify where their challenges are, where their strengths are, and then we can find out and set goals and determine a treatment plan so that their relationship can be repaired and rebuilt, and in fact, a very satisfying experience. And so we have the sound relationship house theory to underlie this process for couples therapy. Cole, I'm ready for the next one. So what are the benefits of becoming a certified Gottman couples therapist? It's a really good question, right? So generally speaking, to become a certified Gottman couples therapist, we complete 3 levels of training. First level, level 1, is a 2-day workshop. The second level is a 3-day workshop that allows you to dive into assessment and intervention, understand intervention and practice how you would set up interventions for your couples. And then we also look at comorbidities. So we're then examining things like infidelity. How do you assess for and treat infidelity? We're looking at how to help couples with PTSD. We're looking at how to support couples who are recovering from addiction. We're also looking at domestic violence and how you would deal with a couple who present with domestic violence. So that allows us to really sort of fill out our couples work. So that's level 2. And then level 3 is a practicum, where therapists are presenting their cases and working on their cases to develop their skill set to be able to treat couples completely using the Gottman Method Couples Therapy. And then after that, therapists are able to apply for the Gottman certification track. Now that involves a quite rigorous experience, usually 1 to 2+ years, working with a supervisor, a master consultant from the Gottman Institute who really examines and oversees the work of that therapist, watching videos that therapist has made of their work with couples, and the consultant then guides the therapist and helps them to become qualified and competent in delivering the interventions within the Gottman Method package, essentially. So why would you become a certified Gottman therapist? Essentially, it makes your work much better, but also the title of certified Gottman couples therapist has become far more well known both in the clinical population as well as the client population. So both referrers and couples themselves know about the title, and they're generally seeking out someone who is certified in Gottman Method Couples Therapy. So what kind of support can you get after the training? Okay, so the great thing, one of the things I absolutely love about the Gottman therapist community, both in Australia and overseas, is that we have a very strong support network, almost like a family. So there are Facebook groups that you can join. There are peer supervision groups that you can join. We're very much connected as a community as Australia. As I said, we often run events together. We will have dinners together. We have peer supervision groups. We might run retreats together. We might even put on workshops together or run couples workshops together. There's 2 Gottman couples workshops, the Art and Science of Love workshop, as well as the 7 Principles for Making Marriage Work workshop. So you can get together with a Gottman colleague and run these workshops as well. And then there's also the support in the USA. And so we are very much connected in Australia with our Gottman community in the USA and around the world, linked by social media groups, and we all get together in person as well. So the level 1 training, clinical training, Gottman Method Couples Therapy, is the absolute opportunity for you to continue to level 2. So it's level 1, it's a 2-day workshop, and we run through the real sort of the whole model. We look at the research, we look at the sound relationship house, right, which is the theory that underlines our assessment of couples, as well as what underpins and forms our interventions, and then also provides us with the ability to sort of reassess and keep finding out, okay, where do we need to increase the work on with couples? What little corners of their relationship still need work? So that's what we're doing. And then we look at the series, the conflict interventions. So level 1 will provide you with a packet of interventions to help a couple strengthen their conflict management system, interventions that also help a couple strengthen their friendship and intimacy system of their relationship, and then also interventions that will help a couple strengthen their shared meaning system of their relationship. So level 1, we do that. You complete a quiz, and then you are ready to head off and do level 2. Yes, so I am available for clinical supervision once you've completed level 1, and you are also very much welcome to join part of my peer supervision groups. I run a monthly peer supervision group in Sydney, and I also have a group online that allows you to access resources. It allows you to access various different resources that kind of are complementary to the manual that you receive, as well as peer discussion with your colleagues. And then, of course, I am available as well for one-to-one clinical supervision should you wish to have that too. You know, this is a really great question. So the question, right, is what are past participants saying that how their work has changed completing the training? I keep in touch with a lot of my trainees, and as I say, they come along to supervision. What I have found with people who've recently done the training is that they're ready to go. They're applying the protocol, the Gottman protocol, straight away. They're finding it's very easy to use. There's a very thorough and in-depth online assessment that couples complete, which comes through the Gottman Institute. It's from the Gottman Connect website, and the couples will complete these assessments. And so therapists are finding even just having this assessment tool that provides them as clinicians with all of this information that they have been able to gain from the couple by the couple completing this questionnaire has been a real asset for their process in couples therapy, because what they get is the information that the couples have provided about their relationship. There's an automated analysis that comes from the questionnaires. The analysis then informs the treatment protocol for the clinician, and it's very clear. So the couples complete the questionnaire, we get the results. They have an automated analysis created, and then clinicians are able to say, oh wow, I can just see, right, this couple needs work on their conflict management system, but hey, their friendship and intimacy is going really well. They still seem to have a lot of fondness for each other, so that they can automatically come in and start doing the couples therapy and start implementing the interventions straight away, because that assessment process has already been set up and done for them, ready for them to interpret and then implement the interventions that they need for their couples to create a better relationship. So, you know, like any training, right? Pros and cons for face-to-face or online, right? So if you choose online, you can do that in your home, you can do that in your office, you can do that, you know, sort of in your own space, and you can do that anywhere. And so that's probably the biggest benefit for doing online, is that it's just so accessible. It's accessible for you to do, and that's one of the benefits really in doing online. Whereas the face-to-face, we're in Sydney, so we'd be coming into our training room in Chatswood, and that's great if you're local, and it's a great idea if you are local and you want to come in and meet your colleagues in person. But there will still be opportunity to get to know your colleagues if you're doing the training online, and you can do it in your pajamas. So that sounds pretty good to me. And Cole, I'm ready for the next one.
– That is all of our questions for today. Thank you, Liz.
Okay, thank you so much, Cole, and thank you for having me. And I hope to see you all at one of the trainings.